for a lot of people, when it comes to medical trauma, I think what is in the base of the anger is grief, is sadness, is uncertainty. And sometimes we can work against ourselves by fueling the anger in order to not acknowledge or process the grief, right, the sadness, the disgust, the fear that exists underneath it.
Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Hello, everyone, and welcome to the Medical Trauma Support Podcast. I am super excited because today I get to talk to Dr. Sasha McBain, who is at Rush University Medical Center. And well, first I want to say hi, Sasha. Thanks for being here.
Hi, thank you for having me.
And I have to just tell the listeners that when I got introduced to you, I was fully like a fangirl because when I was doing my medical trauma research, you know, in my graduate program, but also trying to find help for one of my children, you were the first person that I found that was actually talking about medical trauma like as the umbrella, right? Because there are so many people that are like looking at medical trauma specific to NICU or specific to cardiac events. But you were talking about medical trauma, which was something that it was really a phrase not a lot of people were using and still really aren't. So I just want to share that with the listeners because I want them to know that we have this amazing expert in medical trauma with us today. And so I'm super glad you're here.
Well, thank you. And I really appreciate that. And it makes me feel good because when you are, creating different handouts and doing all of these things, sometimes it can feel like, oh, is this resonating? Is this, what people want to hear? Is this validating? And so I just really appreciate you saying that and that to see the impact of some of the things I've worked on for you professionally and personally is really lovely. So thank you. And thanks again for having me.
Yeah, I'm happy you're here. So I was hoping you would tell us a little bit about how you got into this world, especially because there weren't really other people doing it. Like what brought you to it?
Yeah, so it's been a long time coming and started really not even really on purpose. So when I was an undergrad, my best friend, we were at the University of Utah together, and she worked at Huntsman Cancer Institute as, a research assistant, and a new lab had a position open, and she was like, hey, you should apply for this. Pays great money. It's an easy job. And I was like, yeah, I'm an undergrad. I'm like, yeah, sounds great. It's the most money I'd ever made. And little did I know that it was going to change the trajectory of my life. And so I got involved in a project working on colorectal cancer research and looking specifically at people who are at high risk to develop colorectal or breast cancer and what kept them from accessing screening procedures that could help catch the cancer earlier and get treatment underway. And so, as you can imagine, there was like a lot of the usual barriers. People didn't know that screening was a thing. They couldn't access it. They lived too far away from the cancer center. They couldn't afford it. But one of the things that really struck me as I was doing interviews with our participants was how many people were talking about their own experiences in the healthcare system and of their loved ones who had gone through cancer treatment. And it really struck me that people were saying things like, I know I should get screened, but I don't want to know because I saw what my mom went through. Right. Or I've had my own experiences and I don't trust doctors and I don't want to go down that road. And so it really struck me, and I heard it over and over again, and nobody else was really talking about that piece of it. And so it led me to my graduate studies, where I worked with Matt Cordova, who is an expert in psycho-oncology or kind of the overlap of psychology and cancer. and really he focused on post-traumatic stress disorder. And so with his mentorship and my other graduate mentor, Joe Ruzek, who focused on early and preventative interventions after trauma, like how do we get people recovering sooner after they've been exposed to these types of events, I was able to kind of combine those two experiences and kind of develop a program of like, well, what if we went into hospitals? Like if we know that people are experiencing these things, they're having these traumatic experiences while they're at the hospital, why don't we have psychologists like me who know about these two areas meeting with these people at bedside, meeting with their families, giving them the skills that they need, helping them to process these experiences so that they can live as much of a meaningful life as they can in the face of navigating these really intense stressors.
And feel more okay stepping back into the system,
Yeah.
because pretty much every human is going to need medical care at some point.
Yes, absolutely. Yeah, because we know that when people are experiencing the impact of trauma, they're less likely to go back into these systems, and that can actually perpetuate these health concerns, right? If you're not getting things checked and getting the treatment that you need.
Yes,
Um,
absolutely.
and so, long story short, I focused my clinical training on being in medical settings where I knew these things were happening, but working with my grad mentors to really understand trauma treatment and how we help people get better after trauma exposure. So I really understood how to be in these hospital environments, but bringing this whole other set of knowledge and skill set to these environments. And so I developed a trauma surgery psychology program in a hospital where I would meet people at bedside after a traumatic injury for lots of different things that caused that, and did that for several years before landing here at Rush, where I've been really thinking about like, okay, I kind of understand what needs to happen at the bedside, and there's more and more people doing that. But what happens when they leave the hospital, when they go back into a community with a therapist who has never even seen the inside of an ICU or hasn't had these experiences? And so in the last few years, I've been really focusing on like, and now what do we do when people go back home and they need the support after the hospital?
Right. I feel like every hospital and surgery center should have support groups,
Yes.
because it's like, first of all, by even having that, they're acknowledging we know that there can be emotional trauma, even though we're here, we're trying to help you heal and save your life in many cases. And we understand that there is trauma that comes along with that. I mean, I just feel like that piece alone would be so validating to the
Yeah.
millions of people who have experienced medical trauma.
Yes.
Um, I love that.
Yeah. And it's hard as, working in the injury space or kind of critical illness where you can have such complicated feelings of I'm so glad that I survived, and I wish it didn't require all those things that I went through. Um, or I wish that I didn't have to go through all of these things, right? So it can be really complicated as you're navigating life after a life altering, life changing injury or illness.
Right. Yeah. Yeah, we have some podcast episodes that are already out where people have shared their stories of having, a visit that required, or an experience that required an ICU visit. Somebody talking about how they chose to step out of the medical system. And both of these in their stories, they have shared ways that they have healed as well, the ways that they've been on their healing journey. And of course, both involve finding support, and support that really understands this world, this medical stress, this medical trauma world. And well, I think that's amazing that you're working toward that. I would love to hear more about what you created originally, like what you created with your two mentors. Can you tell us a little bit about how that worked?
Yeah. So the first thing that I focused on is we have these treatments that we know work for post-traumatic stress disorder, but we don't have a lot of studies or evidence about how they work specifically with medical events. And so the first step was to kind of try out, like, okay, what if we treated this like how we treat other forms of PTSD? And what might that look like for somebody? And how might that feel? Like, is this going to hit for them in terms of what they need? And so what I found in my clinical work was that it did, and that people could get better, and that it wasn't so much that we needed to change the treatment itself, but the things that we kind of talked about and included as part of the work that we're doing. So one thing that, comes up specifically for medical trauma is people have a lot of sensory memories. So they might not remember exactly what happened, but they remember a sensation. And so being able to work with sensations that maybe don't have a direct memory associated with it can be really challenging. And something that maybe people don't even think of as being part of their PTSD picture. And so those were things that we started incorporating in, of like, how do we pay attention to sensations in the body and noticing what those sensations remind you of, or what thoughts they bring up, or what emotions they lead to, and making some of those connections. So that was what we started with on the outpatient side, is kind of focusing on that. And then also thinking about how people support each other after a health crisis. How do we make sure that caregivers, that family, that friends have the right language, have the skills to be able to hear about these experiences? As you know, we get a lot of training in hearing these types of stories and
Yes.
how to respond to them. And so how do we equip families with some of those skills? And how do we get people talking to each other in order to disclose emotions in a way that both parties are going to feel supported and validated at the end of the experience without feeling triggered?
Right, because I think I've done some work in um caregiving, like the impact on the caregivers for the person that's experiencing medical trauma. And um, it can be really intense and scary for the caregivers. And I'm thinking about myself as a parent in that situation. And it was really traumatizing for me. And I think
Yeah.
it can be hard for the caregiver to have to hear what the experience was for someone they love so much and that they want to keep safe and keep safe from suffering.
Mm-hmm.
So yeah, I think that is such an important part to like think about, how do we help the caregivers to, maybe regulate themselves, prepare themselves to be with that.
Yeah. And not jump to fixing.
Right.
Which is really hard, and that we all want to do, right? Is when you see someone you care about in distress, your natural instinct is to want to, okay, nope, stop, don't feel that. That needs to go
Yes.
away. And it's like, that's actually the thing that we know that gets in the way of recovery, and that being able to really process those feelings with trusted others without the intention necessarily of fixing it, but just honoring it as it exists, is part of that recovery process. But that's not the thing that most of us jump to when it comes to offering support.
Right. And it's probably why so many people find therapists, because
Yeah.
therapists are trained to sit with people as they feel these and to be with them, so they're processing this with someone who's like attuned and there with them.
Yeah, absolutely. And you could think about how this is even more magnified with healthcare providers, especially like you were, kind of mentioning that, I worked on a surgical service where, the staff knew that the things that they had to do to save somebody's life could be really harmful and leave an emotional scar. But how do you hold that in your mind of like, this thing that I have to do to save this person's life is also going to fundamentally change their life forever? And being able to sit with those feelings are also something that healthcare providers don't get any guidance or training on. Or, thinking about somebody who is, a family medicine doctor who is kind of trying to navigate all of these pieces, and having a patient come in talking about these experiences and not knowing what to do with it. And so dismissing it, or, oh, that's not a big deal, or it's just this, is like a way for them to kind of try to manage their own feelings around it and their own discomfort without having the skills and the practice to have these conversations.
Yes. Oh, that makes so much sense. Yeah, it's a really hard position for them to be in, a really hard position. And then oftentimes they have their own medical experience as a
Mhm.
human who has, a body
Yeah.
that will often need support. So then that adds even more layers to it.
Mm-hmm.
Yeah.
And when we kind of look at it at this systemic level about how, as a society, there's so much stigma around talking about these things, that translates into the interactions that people are having within the healthcare system, um, conversations they have with themselves or their own experiences, and ultimately patients bear the brunt of that. And so when we're thinking about intervention, it needs to be how we learn how to cope ourselves, but we also need to think about our social environment and these things that we're talking about, but also how do we make system change to reduce the risk of people being exposed to these things, or from doing things that are going to make it more difficult for somebody to recover, like invalidating the experience, or
Right.
doing discriminatory things in the context of somebody's care, or invalidating them.
Yeah. Yes. And all of these things are real things I hear people talk about when they're looking for support around medical trauma. Is the experience of being invalidated is huge.
Yeah.
But yes, also understanding that there is, when you're working with somebody who is has like compassion fatigue, or they're burnt out, or they have a dysregulated nervous system because this work is so challenging, that it's hard to turn around and slow down and attune and respond in the way that I think we need somebody to respond to us, and when we have experienced medical trauma.
Mm-hmm.
And something that this like parallel that just keeps coming up for me, and you said some things today that made me think of it, and that is complex trauma and medical trauma. I feel like they have so many parallels,
Yes.
because you have oftentimes that pre-verbal trauma where your body does talk in sensations, and versus like these clear words or stories about what happened, and being medicated and having the medical procedures. It can kind of almost put you in that same place. And then
Mm-hmm.
there's the part of going into a place where you're going to be with people who are supposed to take care of you, and being hurt, whether it's you're being hurt in the while they're saving your life, right? That happens. um so there's so many parallels between those two things to me.
Yeah, so many. And I think that the idea of the power differentials,
Mm-hmm.
our attachment styles, like our relationships with early caregivers, those all show up when we're at our
Mm-hmm.
most vulnerable and our most scared. And that's
Yes.
the space we're in, that survival mode, literally, in these settings.
Mm-hmm.
And we are at the mercy of somebody else's expertise, knowledge, and willingness.
Right.
And that can really, it can mirror prior experiences,
Mm.
and it can look like complex trauma. And many of the people that I work with will say, my diagnosis was stressful, of course, but it was these relationship pieces with my family, with my work, with my community, with my providers, that really shook me. And those experiences can be really, compounded by these experiences of discrimination and bias that happen in healthcare settings, and the moralizing of health, right? We have these ideas that, whether we talk about them out loud, or they're just kind of in the back of our mind of like, good things happen to good people, bad things happen to bad people. So why is this thing happening to me? You know, I would hear people all the time talk about with a new diagnosis saying, but I did everything right. Why is this happening to me? And sometimes the care environment can reinforce some unhealthy ideas about why things happened. You know, put blame where blame shouldn't be placed, or, you know, make things more complicated, or, you know, reinforce messages that people might have about self-blame that are not accurate and definitely not helpful. And so that's something that we, you know, and that again shows up in families too. I think that ableism is something that many of us haven't reconciled in ourselves, and that can really show up when we ourselves are ill, or when somebody in our life is ill, of like, oh no, you're going to get better, it's okay, no, you don't need those benefits. You know, like there can be so many different messages that come up about like your ability and your ability to be a quote unquote productive member of society that can really, really complicate recovery and adjustment in the face of illness.
Absolutely. And what that also makes me think of is something that is a really common feeling for people in this space and people who've experienced medical trauma is there is so much anger. There's, you know, obviously so much grief and loss when, you know, especially talking about abilities and what we can do, but there's also so much anger.
Yeah. Yeah, so much. And I think a lot of valid anger.
Yes.
You know, people are navigating really inadequate and broken systems.
Mm.
You know, the average time to a rare diagnosis is over a decade, and that's unacceptable. You know, people are, you know, faced with medical mistakes of insurance not approving medications and treatments. Like there's a lot to be angry about, and the emotional and cognitive and physical injury, or excuse me, the physical energy that it takes to manage all of these pieces, um, it can be too much at times, many
Absolutely.
times.
Yes.
And that makes sense that people feel so angry, and there's so many feelings that come with that.
Mm-hmm.
And it can be really tough to kind of sit in that space and know what to do with those big feelings of anger.
Right. Right. And those big feelings of anger, you know, however valid and right they are, sometimes if we are showing up in that way with care providers, it's not going to get us the response that we want from them, because people typically, when you show up with anger, like out in the world, you know, typically aren't like, oh, let me soften and
Mm-hmm.
open to this. Wow, they're really having a hard time. Oftentimes the defenses come up and it doesn't go well, and it can be like it can hurt you again, right?
Yeah.
To have that negative experience with a healthcare provider after you've just gone through medical trauma.
Yeah. And it's really isolating when,
Yes.
you know, and I think that anger, I kind of like to think about it as, you know, the iceberg, right? It's like
Mm-hmm.
icebergs are, you know, we see the tip above the water, but really the biggest mass of the iceberg is under the water, right? And I think that sometimes anger is the tip of the iceberg, that what we can see, and it can be really destructive. It can be, you know, a warning sign. It can be a sense that something else is going on, and it can also be a really protective and action oriented space, emotional
Yes.
space.
Yeah, setting bound, like I feel like you need that to set strong boundaries sometimes. So
Yeah,
it's not bad. So I want everyone listening to know we are not
yeah,
saying anger is bad. It's actually really important, protective emotion.
yeah. All of our emotions are information. And I think that anger tells us that a boundary has been
Mm-hmm.
crossed, that a value has been compromised in some way. And so that that is there and that exists. What we sometimes see is with what's that big base of the iceberg, especially when we find ourselves stuck in anger. So anger is more like a productive temporary emotion, right? To have like a flush of anger, to have an action oriented response, right? That might be really healthy. That might be an appropriate response. That might be something that keeps us safe, or, like you said, sets a boundary. But lingering anger that feels really sticky and it's hard to get out of maybe tells us about something about the base of the iceberg. And for a lot of people, when it comes to medical trauma, I think what is in the base of the anger is grief, is sadness, is uncertainty. And sometimes we can work against ourselves by fueling the anger in order to not acknowledge or process the grief, the sadness, the disgust, the fear that exists underneath it.
Yeah, they feel more vulnerable, right? Like anger is kind of this thing that feels like not as vulnerable and soft. And so, like you said, it can be this nice protection, but once we can start to be with this stuff underneath is when we start to heal and kind of change in a positive way. We start to like see growth through that.
Mm-hmm.
And I know you've sat with so many people in that space to see that change.
Yeah. And I think that part of it is how do we hold, usually, we're speaking in general terms here, but when we're thinking about anger, is that sometimes it can come at the cost of other things that are important to us.
Mm-hmm.
When we are so overcome by it that we're really irritable, we're short, we're distant, each emotion has a physical expression. Your heart rate's up, your blood pressure's up, your muscles are tense, you have headaches. The holding on of the anger, the difficulty processing it can have impacts on your body. It can have impacts on your relationships, how you view yourself, how you view other people. And so being able to first recognize the cost of the anger and how it might be getting in the way of other things that are important to you, is a really, really hard thing to do for all the reasons that we've talked about, because of how protective anger can be and how exposed we can feel when we start to put that emotion down and, think about what might be coming down the pathway behind it.
Right.
So it takes a lot of courage to really confront anger, and what it is, how it's showing up in our lives in ways that maybe are not as helpful.
Yeah, absolutely. And I think too, yes, these are like, underneath the anger, there is a lot of vulnerability, but there's also, for some people, it doesn't even feel safe to be angry.
Yes.
So being able to even like sit with and acknowledge that you're angry, for people who are kind of trained like, no, 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 you don't get to be angry. That can be, even that first step can be pretty painful and challenging.
Absolutely. And I really appreciate you bringing up that point, because I think that that's probably the majority of people. It's like, I'm not even like willing to acknowledge that I'm angry, let alone like express it in ways. And I do think that it ekes out. Like, people, oh, I'm not an angry person. And then, people in the family are kind of like looking around like, it's like, it shows up, like it can be in your energy space and you might not even realize how much it's impacting you. And so finding safe ways to acknowledge anger, why it's valid, what it might be protecting you from, is all part of the work. And I think that a really, really key important part of that is acknowledging that acceptance is not approval. And that when we can accept that something has happened to us, that it's had an impact, that there was potentially another party involved, a perpetrator, so to speak, that acknowledging that and accepting that the thing has happened is not you approving of it, but we have to acknowledge before we have to see the iceberg in order to turn the ship.
Yes.
And sometimes that means that there is no satisfying answer, that maybe that there wasn't one thing that could have changed that would have righted the path.
Right.
And that these factors, random and otherwise, came together in a way that caused you harm, caused someone that you loved harm, and that you are now having to deal with the consequences of something that you didn't choose and that you didn't want.
Right. And just, I mean, it makes so much sense to be angry. I mean, literally just that like last sentence, it just makes so much sense for people to feel that anger. And I hope everyone listening who may be struggling with feeling that anger or processing some of that can hear that and hear that it makes sense to feel that way.
Yeah. And I think that probably some people listening might say, but where do I put it? How do I process it? What do I do with it? And again, if we come back to the idea that anger can be energy, how do you pour that energy back into self? Like, how do you use that momentum to show up for yourself in a new way, right? Like to act in a different way of, if the anger is part of, I was so deeply dismissed by somebody else. How do you show up and validate your experience? How do you name it? How do you honor it? Do you write it? Do you act in a way? Do you really prioritize your self-care? Do you set boundaries in a new way in your life? Like, what is the opposite action of the thing that occurred that has led to the anger? This person disappointed me. They didn't hear me.
Yeah.
How do I show up for myself? How do I take care? How do I prioritize my needs? How do I release self-blame and place blame appropriately while also being able to leave it there as if it happened that can't be changed?
I love that because I think like those are things that people can do. Those are like very specific actions that people can take. And I think that's great. Having like individual actions, then, it can also be so helpful to be able to find a therapist.
Yes.
Like Sasha, you were talking about where you would sit with people and help them with this. A therapist or like a support group, or, Kristen Mullane's new book is a workbook that people can use to work through some of these questions. So I mean, I love, that you're here, like normalizing it, giving tips for what they can do. And also, I want everybody to hear that there are a lot of different options for this process. And, it's kind of unique to each person, like which combination of things is helpful for them. But I love what you said about, um, you know, not being heard. So, like, maybe a lot of that anger comes from not being heard. And how can you turn and listen to yourself? Like, how can you do that opposite thing and listen to yourself? And there's just, that just makes me think so much just about that self-compassion piece.
Yeah.
And how important that is, no matter what it is that's causing the anger or the fear, or the more we can lean into like that self-compassion, I guess the stronger we'll be in processing this.
Yeah, absolutely. And this is hard, let alone when you're feel ill, when you're navigating the day to day where it's like, I have no spoons, right? And so I think it's also patience in the process that, I think sometimes it's like we can be the overly tough critical coach on ourselves too, of like, just get over it, or you should be, doing XYZ, or, all the should, would, could statements. And so I think that's exactly where self-compassion comes in, of this is a day by day process, and you are a complex being who is moving through time in a world that's changing every single day. Um, and you will change in response to it. And there's some days where, yeah, you're going to be really caught up in anger. And there's going to be days where that weight feels a little bit less, or you might not think about it at all. And I think just being able to use some of these practices to hold that and think about what your risk factors might be. So, where are those days where you really find that you get stuck in that place? Like, is it when you have an idle mind where you kind of find yourself starting to kind of like chew on it and ruminate and get really stuck in it? Are there certain cues that come up? Something you see in the news, a particular situation that comes up, something you see on TV, an interaction that you have that kind of cues the memory and cues that emotional response. Like knowing when you get stuck or when you might be at risk to get in that place also gives you an idea about how to cope ahead. Like, okay, I know I have this test coming up next week, and I know I'm gonna be biting my tongue with as I navigate this. Like, how do I take care of myself before, during, and after this process? And I think that's
Yes.
where support groups, people who've been through what you've been through, therapists who can help you with these skills, family support, can all be really crucial in this as well.
Yes. And having the plan that you write down, because when we are in the moment and we're feeling really dysregulated, it is very hard to access this part of our brain that helps us remember what
Mhm.
we wanted to do. So, physically writing down the plan can be so helpful, and you can pin it up somewhere that you're going to see it. If you are having a day where you're really struggling, or you're going to a medical appointment for a test, like have it with you, bring it with you. You've got your plan.
Yep, absolutely.
I love that.
And I think that anger can be felt so strongly in the body as well. And it can mix up with sensations that might be related to medical trauma. So again, I mentioned like
Mm-hmm.
heart rate,
Mm-hmm.
or feeling your throat tighten up, or feel a headache coming on, or even like lower back aches. And these other sensations can feel so strong. And so I think like somatic coping strategies or kind of
Mm-hmm.
body based interventions, like ways that you can kind of pour into changing how you feel
Mm-hmm.
physically, can also help with like processing and learning that you can tolerate these sensations as well.
Absolutely. I love somatic work. You're speaking my language. So, we talked a little bit about how rumination can be part of the experience with medical trauma. And when you are feeling really angry, it can be easy to get caught in that loop, those thoughts over and over. And like you said, that you can really feel stuck when that happens. And so, there is a somatic practice called orienting that really helps stop the ruminating. And so I'll show everybody, I'll explain it for people who are just listening, but I'll show it for people that are watching the video as well. What you'll do is you'll open your eyes a little bit wider than you would typically have them. So you're opening up your peripheral vision a little bit more than usual. I'm looking up toward the horizon. So I'm not looking straight ahead. I'm looking up a little bit. I'm not all the way up to the ceiling. So, with my eyes open a little wider and looking toward the horizon, I'm going to start looking over my right side, looking a little bit over my right shoulder. Do this to the best of your ability. I know not everybody is able to go that far over their shoulder, but now I'm going back over my left shoulder this time, and going all the way, looking a little bit behind my shoulder. And I'm really moving slowly. I'm not rushing this process. And then I'll come back to look straight forward. And so, again, that can really like stop rumination in its tracks. And it can also help us when we are in a space, like maybe we are in the doctor's office, we're in a new place, where we are really letting ourselves and our nervous system take the time to check out the space that we're in. It can also help bring you back to the present moment if you have been triggered, to look around and see where you are and acknowledge that you're in this moment. So that's one somatic practice that can be helpful.
I love that. It's an active strategy that you can use anywhere.
Right.
So that when you are feeling overwhelmed or kind of taken over by whether it's anger or any other strong emotion, is that you can quickly do that. Nobody's going to bat an eyelash at it. You just looking around a room. So I think it's a really nice tool to have in your toolkit.
Sasha, thank you so much for being here and sharing your time and your expertise. And I wanted to see if there's anything that you wanted to leave the listeners with.
Yeah, I mean, first, thank you for listening in, and I hope that this was helpful. That is my number one mission in doing this work, is having a positive impact for people. And so I hope you leave this feeling heard. And also, I want you to feel encouraged that there are people like me and like Sarah who are working on this, who are really invested in this work and making sure that we're supporting people who are going through medical trauma. Help is out there. We're working on it. More and more of us are focusing on this in the mental health field, and that recovery is possible, and it's possible for you.
Yes, recovery is possible. That is a beautiful way to end this. Thank you so much, Sasha.
Thank you for having me. Take care.
Thank you so much for listening to this episode of the Medical Trauma Support Podcast. If you are looking for some tips to soothe your own nervous system, you can go to my website and find a free guide to doing that. The website is medicaltraumasupport.com.